When somebody who has lumbar stenosis and you're going to elect for surgery, they failed conservative treatment, when do you just decompress and when do you stabilize? It's a very good question. It's very patient specific, but there are a subset of criterion that we use to discuss with patients when we think they would benefit from a stabilization infusion and when we think they would benefit from just a decompression. The first and most important is if they have dynamic instability on flexion extension, meaning they have a spondylolisthesis or an anterolisthesis, which is where one bone is shifted forward on another bone. And if they flex and extend, then you see motion forward and back of the upper bone or the upper vertebral body on the lower vertebral body. If it's more than 3 to 5 millimeters, then we would say they have dynamic instability and they would meet criteria for fusion. The second criterion that we use is if patients have severe foraminal stenosis, not just central, but foraminal, where the nerves exit the side of the spine and leave to go down the legs. In patients who have severe foraminal stenosis, we can't actually decompress them adequately through just a midline laminectomy and medial facetectomy. For us to adequately decompress them, we have to take off a lot of bone. And to take off a lot of bone, it creates what we call iatrogenic instability, or instability that we create to decompress the nerves. When we remove that much bone, we make the spine unstable. We then have to stabilize and fuse it. Those cases, you have to really look critically at the foramina. You have to see how far into the foramen does the stenosis extend. Is there degenerative disc disease associated with it, or is the disc normal height and it's just a herniation? Because sometimes if you have a far lateral herniation, you can do a far lateral discectomy and you can take care of the foraminal stenosis from a disc herniation. But sometimes when there's no disc, the disc is eroded away, the foraminal stenosis is significant, and you have to unroof the entire facet to really decompress the exiting nerve root. And in doing that, you will render the patient unstable and you'll have to stabilize them with pedicle screw fixation and a fusion procedure.